My life changed overnight. In 1989, I was hit by a drunk driver on an 85-mile-per-hour head-on collision, and I've had 24 surgeries. This will be my 25th surgery. Arthritis has set in really bad.
A fall or a car accident which causes an overload to a joint, which leads to the cartilage thinning out. The only thing left is bone of the ball and bone of the cup to articulate with one another, which is essentially like walking on a grindstone.
And I know she's in pain every single day. She refuses to take pain medication. She only takes it very, very rarely. And that's when I'm like, Mom, you have to take something.
So it's time to get that arthritis up, time to get a new hip.
So, right hip?
Right hip.
Okay. And we ready to take care of this tomorrow?
I'm ready. I am waiting. I'm very excited.
We're doing a total hip replacement, which means we're replacing both the cup and the ball.
Go ahead and have a seat, and the
Okay,
nurses
thanks.
will be right up for you, okay?
This is it. I'm going to be out of pain, and I'm going to be walking normal, and the doc is going to put me back together, and I'm going to get the newest of hips, and I'm very excited about it. Hi. Everything will be fine. Okay, I know it will. I know. Well, I'm in good hands. Oh, I am very excited. I am. I'm very happy.
Okay, we'll get you all taken care of, okay?
Thank you. I am.
All right.
Thanks.
I'll swing you around here and back into the room.
All right, Nancy, just give me some slow, deep breaths. All we need you to do is just think nice, positive thoughts and think of all the new things you're going to be doing with your new hip. You're going to take great care of it.
Through integrating technology with advanced anesthetic techniques and the most recent evidence-based guidelines, we're able to transform what was once a major operation where patients would be in the hospital for 4 or 5 days, sometimes even up to a week, into an outpatient surgery where patients are going home even on the same day. 1, 2, 3.
Okay, yep, she's here for a right primary total hip arthroplasty. Case should take about an hour. Blood loss will be probably 50 to 75 cc's. Okay, all right, we're starting. Small approach, it's about 6 or 7 centimeters, okay? And it's kind of in the flexion crease of the hip. So this is what we call a bikini approach, Southern California. So it's one of the more...
On a 73-year-old, okay.
Yep. One of the more cosmetic approaches, but moreover, I like it because it has kind of one of the lowest risks of any wound issues.
Okay.
Ball comes off, and you get a geometric cut right here, where we take off the neck of the bone, and that gives us the ability to put this stem down here, which is again made of titanium. And then you get a new titanium cup in here. And then this liner is again made of plastic, and that locks into the cup. Okay, pretty good fit. Let's check stability. Posterior, no impingement here. Okay, all right, good.
Oh, yeah, I'm waking up and, oh, wow. I can't believe I just had the surgery a few hours ago.
I know.
mean, this is like
crazy
a
how
miracle.
fast you get up and
Yeah.
move, huh?
Okay,
Okay.
okay. Look at that. And oh my gosh, I walked in and here, surgery was just a few hours ago.
Yeah, you're doing wonderful. Yeah.
Is this unbelievable? Oh,
How you feeling?
I'm just getting a little tired, but I walked.
Good, how'd it feel?
I feel fine.
Good.
I mean, I'm just like, I can't believe it.
I'm very happy to hear that. Everything went excellent. You had very bad arthritis in there, as you can imagine.
It was really bad.
Yeah, bone on bone. So, yep. So, brand new hip, cup and ball. Everything went perfect. Closed up very beautifully, like I said. Wow. A nice Southern California closure. All right.
Oh,
like I said, everything went
thank
great.
you.
Yep.
Thank you. I'm in awe.
For Mom, being able to be in her own bed, her own space, not in a hospital where she's having to be checked on all night long, not getting a good night's sleep. It was home, it was comfortable, and no complications whatsoever.
Hi, Nancy.
Hello, I'm ready.
Good. I'm ready for you. I have no doubts Nancy's going to be able to do whatever she wants to do. The game plan is getting her glutes stronger, especially in positions where Her foot's on the ground.
Very nice.
The goal today was also just to incorporate a little bit of balance, having her do some of that weight shifting and tapping. When you can kind of see the light at the end of the tunnel, you really start moving and making progress.
It's healing wonderful. This is 5 weeks, and look at me.
Sky's the limit for Nancy.
Give me a hug. You've been great. I love it. I love it. You've been fabulous.
All right, Nancy, keep up the good work.
I wouldn't be walking if it wasn't for you.